Hey gang, Denise here. I'm doing something a little different today. It's going to be a longer video, so if you're interested in the topic, you might want to stay with it. What I'd like to do today is work with a friend of mine, actually, one-on-one, and she's struggling with low back pain, and I'll go into the details of that in a moment. But my purpose for making this video is just to kind of give you an inside look at how it might be that you work with somebody who's got a very specific and challenging issue as a yoga teacher. So I have this friend Candace, who is actually an ideal person to work with because even though she has a tricky problem that she's working around, she's very dedicated to having a movement practice. She's got a long history of taking care of her body with exercise, and she's played sports, and she has done yoga in the past. That's one of the main things that she's struggling with right now. She's using weight resistance and other forms of training, but having a real struggle with a yoga practice. So that's what I'm really trying to help her with. We're going to go through some movement with her. I'll do a bit of a movement test with her. She's got a long history, which I'll disclose to you in a minute. But, you know, I just want to show you some steps that you can take that make sense. It's not rocket science, but we're going to work through this problem together, and I hope you find it interesting. So Candace is a nurse. She's got a long history of working in ICU and working with home care and some very challenging tasks to do with moving patients and turning them and whatnot. She's, you know, kind of challenged and maybe exploited her back a little bit over the years with her job, and probably developed some movement habits that didn't serve her very well. And, you know, she had this kind of brewing tissue response that became evident in about 2013 when she had her first herniated disc. What was the activity that you were doing? I think with deadlifting, is that right? Yeah, so she was deadlifting, which is, I'll quickly show you what a deadlift is. She was using resistance, and she was probably coming up with a bent knee. Yeah, so she was deadlifting like this. There's also deadlifts with straight knees. But you can see that there's a powerful hip flexion and back extension that needs to happen there in deadlifting with weights. So you can see how that would challenge her back. The next incident was in 2017. And by that time, she had become a massage therapist. So she has a nursing background, went to school for massage therapy, and started to practice as a therapist. She had, you know, 2 years of school under her belt, and she started to develop her practice with clients after graduation. But then she hit a brick wall and went in and had, you know, her back pain and numbness and tingling and all the other symptoms she was experiencing, and found out that she had another herniated disc, which was verified by MRI, and they noticed other tissue changes and all of that. So the thing with a herniated disc is it does eventually, the herniation and the initial inflammatory response does resolve over time, but the bulge and other tissue changes remain, and these compress the nerves. So 2 years later, she's graduated from physical therapy. She had numerous sessions of physical therapy and basically graduated. So, you know, just so you're aware, like a physical therapist is not sort of mandated to make sure she is functional 100% and all her movements are comfortable. They just want to make sure she's walking and she's feeling a bit better. But of course, for somebody who is a mover and a shaker like Candace, she wants more than that. She doesn't want to be you know, walking gingerly and trying to limit her movements and everything to stay within her pain-free range all the time. She wants more than that. She wants to move on from this injury. So that's the kind of thing I'd like to help her with today. Anything I'm leaving out, Candace, you want to add in there?
No, you got it.
Okay. All right. So what I'd like to see Candace do is some of the things she has successfully been doing in the last little while, and just see if there's anything we can sort of add to that. Maybe it's just going to be variety, but some activation patterns is my feeling that we're quite likely going to change. And I'm going to just have a look at these different things, and then we'll go through that with her and give her some options. All right, but the first thing I want to see is how does she move now with really simple things like walking. So we're going to look at walking and standing and move on from there. So I'll begin my movement assessment now. So let's have you stand up, Candace.
Okay.
And I'm going to have you walk back and forth from that wall to here. I know it's not a lot of space, but try and just take your normal stride length, if you could.
Too fast?
No, it's fine. I'm gonna have you do that a few times. So what I'm seeing right away is her feet are actually not turned out all that much, although the right one is, which is interesting because the right one is her most affected side. So I'm watching her right foot turn out a little bit as she walks. And then if I look upstream from there, I'm watching now what happens at her knees, and I can see that her knees hug toward each other. So we may have to help her train out of that a little bit. And then the biggest thing I'm noticing, it's huge, is she does not move her pelvis or rotate her trunk. So let's just come, yeah, and I mean the other thing I can't help but notice is that your shoulders seem to be behind your pelvis instead of aligned over it. It seems like you're leaning back a little bit. Okay. All right, so what is the significance of any of those things? Number one, we know that feet turned out when you walk is a much less stable position. And it's not just for one thing. It's a less stable position for the arch of the foot. You cannot create a rigid arch. And that means that your ankle is not going to be able to be centered over its joint quite as well. It also means that your knees are going to want to hug in as you walk. And this might happen just a little bit, but what happens here is that those mobile knees are going to mean that the hips are going to have to stiffen up a little bit. When the hips stiffen up, then you're going to end up with a more stable pelvis, which in walking, you actually want your pelvis to move. You want it to like move in this kind of rotational way. And upstream from there, your trunk, especially your thorax, needs to be able to rotate from side to side. And that is so that it actually transmits the impact forces from walking up the spine. It dissipates them with those rotational movements as you walk so that your head can stay still and your eyes can stay on the horizon. And if that's not happening, if the stiffness is happening way down, what it means in Candace's body is that those impact forces are happening at the pelvis and low spine, which is exactly where she doesn't need them, basically. So, you know, there's some work we can do with walking for Candace. So we can make her more aware, we can give her some exercises, which I'll show in the next video, that will help her loosen up a little bit with walking, because I know for a fact, and I'm sure as a massage therapist, Candace knows this too, our joints need to be mobilized. They need to have free mobilization so that they receive the nutrition that they need and so that the nervous system can perceive accurately. So that means that like her not moving limits the proprioceptive information that her nervous system gets, which causes even more stiffness in her body. Okay, so then the other thing that I'm going to ask Candace to do is just a little postural assessment. So it seems like I did that in the wrong order, but for me, watching what she did as she moved is even more important than what I'm going to look at right now. So feet together, if that's a comfortable way for you to stand. And just, you know, try to just relax into your normal standing. Maybe I'll even keep talking while you eventually go into your default position, you know? So, okay. So what a good thing about Candace is, if this is in fact her habitual standing posture, is she's not really hyperextending at the knees. So that's good. She's actually centering her knee quite nicely over her ankle, and she's got good ankle extension right here. So that's great. But then she does let her pelvis come forward a little bit. And you know, this is very, very common because actually the ligaments in front of the hip are much denser and tougher than they are on the back side of the hip joint, like of the joint itself, I mean. So, you know, if you're looking for something to lean into, they're pretty good for that, except it puts you in a mechanically disadvantageous position. So if she could kind of ease out of that a little bit, that would be a little bit better for her. And then, you know, if we take her hips back a little bit, maybe press into my hands, then she could draw her lower ribs down and center her shoulders over her hips, over her knees, over her ankles a little bit better. And you can see that she's not really thrusting her chin forward. She doesn't have, you know, much head forward posture. She's kind of got the opposite thing happening. If we were talking about Herniasomatics, she's got a bit more green light manifesting than she would have red light. Okay? So that tells me that she is, in fact, a mover and a shaker. Like her natural tendency is to go. And right now, her whole body's putting the brakes on hard. So I know that's been really difficult for Candace. Okay, so now I want to look at some of the things you've been doing in your own movement practice. And one of them is the bridge pose, which I think is a really great exercise for you to be doing right now. But let's see if there's something that we can tweak about that. All right, so you're going to get down on the floor. Yep, and just go into it like you normally do it, foot placement, and tell me what you're activating. That would be really great. So when you start moving up, all right, so what are you using to do that?
I'm trying to focus on the glutes.
You're focusing on the glutes. And what else? What else is working? Can you stay up with that for a little bit longer? What else is working?
Well, the hamstrings. Yeah.
Yeah. I can see what's not working. Can you stay like that a little bit longer? Okay, so we see that the right foot is doing its thing. It's still turned out. And you see how it's not actually on the floor. Well, neither is the left one either. So she's pressing down through her heels, but not really active through her entire foot. And this foot is still turning out. You can come down, dear. I'm sorry if that was fatiguing for you. Okay, so that gives me an idea of some of the things that we can work on with bridge pose. I know we can make bridge pose a dynamite exercise for Candace, and it will actually help reinforce some of the movement patterns that I think are really important for her. So let me help you up. And then I want to look at her feet.
Okay.
Okay, so you can come on here or on the bare floor, whatever is best for you. And so yeah, feet apart is good.
Do you have the socks off?
If you want, yeah, that might be a good idea.
Let's see.
Great. Okay. Okay. So I just want you to ground your feet, you know, just stand like you stand. Okay. And so her toes, although they're beautifully painted, are not really active. You see, like they're not really like grounding and helping her. So it might just be an awareness thing, and maybe I'll just suggest it, and then that changes it for her like that, or we may give her a practice for that. So now, how is your balancing on one foot?
Pretty good.
Okay, so let's do a very simple balance that you think you could sustain for a couple of breaths.
Sure. Do you want a particular foot?
No, where it will test both of them. Okay. Now your foot's active.
Yeah. Is it working?
Yeah. Okay, let's try the other side. Yeah, so you're a little more consciously setting up that right side. That makes perfect sense. Okay, great. Let's just go around back. Since you can do that, can you just do the this one, but we'll take you from the back side.
Oh, sure. To the left.
Yeah, so whichever one. So she's standing on her right, which is her most affected side. And she's very, very much activating her glutes and her glute med here. So good job. Let's do the other foot. Interesting that that glute doesn't seem quite as strong, or it's just not quite as active. So that's just interesting. We're noting that. I think what happens, you know, a lot of times when we have chronic discomfort on one side of the body, it gets all of our mental attention. So the proprioceptive information from that side just gets all our attention. The other side is just like, I'm not going to worry about you and I'm going to actually ignore you. So, you know, it's good to even out the awareness between both sides, because I bet there's things going on the left side that you're just not going to be sensitive to because you're prioritizing the right side, which of course we're going to do because we only have so much time and so much space in the brain. Okay, so I already have a few things to work on with Candace. You can probably already tell because she's been moving around a little bit and she's done a few actions and activities here that, you know, she's ambulatory. You know, she can move around. There's going to be things that she does that cause discomfort, but she has a place to start. She's not in such a deep hole that she can't do anything. Okay, so what she can do is she can walk, she can stand, she can balance on one foot, and she can do bridges. These are all really important activities for her to be able to do and that we can build on. Now, the one thing that is her main complaint when it comes to doing a yoga practice or other things is forward flexion, right? So I'm going to have her demonstrate that now. So you can go to the side and just show us, without going into pain, what your limit is.
Okay. Well, I can do it. My body just, like here, it's tight and it's that feeling like my body wants me to get out of this position.
Now, what if you keep doing that with your knees bent? If you bend your knees more, what happens?
Better.
It's better. Okay.
And like, if I were to get to the floor, that's how I would do it. Like I would.
Yeah. If you were gonna, yep, that's right. What's the deepest squat you can do with feet apart?
Feet apart, like wide?
Just hip width, say.
Oh. Probably like there.
Yeah, and the knee falls in. Okay. All right. So she's got she can get to 90 degrees with her knee and her hip, but then this right knee falls in when she does that. Okay, so one more time if it's not too uncomfortable. Atta girl. Yeah, so are we seeing that? Yeah. Seeing that? Okay, great. Okay. All right, so actually she can flex better than I thought, and I think we can definitely give her a yoga sequence that's gonna be doable for her now that we can build on later. Okay, so I'm going to wrap that up for now. We've got ourselves set up with a little bit of a physical assessment and something to build on. Next video, we're going to go right there. We're going to give her some exercise and see how she does. Some strategies, activation patterns, that's what she needs. And we're going to take care of her pelvic floor too. Okay, hi gang, Denise here, and thanks so much for watching this video. Just starting to produce some longer form content, and we'll be putting it on YouTube. So hey, if you're interested in following Candace's journey or seeing other things that I put out in the future, I need you to do two things. Number one is subscribe to the channel, and number two is click the little bell so you get notifications when something new has come up. Otherwise, you won't see it. So thanks so much for joining me, and stay tuned for more about Candace and more about whatever is next. Can't wait to see you. Bye for now.